What's up, guys? Dr. Jeremy Landry with Kansas City Laser-Like Lipo. I'm going to talk about the ketogenic diet today, aka the keto diet. Unless you've lived under a rock for the past couple of years, you've maybe never heard of the keto diet, but it is the #1 fad diet in the world right now. It's been like that for the past 2 or 3 years. If you've watched any news at some point, you've probably heard the word keto come up. If you've done simple Google searches on quick ways to lose weight, keto has most likely popped up. So I want to talk about it today, why it's so popular, how it works, and if I recommend it or if I don't recommend it. So to kind of start out with, what is the keto diet? And what you're doing is you're switching your fuel supply on how you're using energy. So most people, if you're watching this right now, this is most likely what you're doing. You consume more carbohydrates than anything and sugar, and your body uses the carbohydrates and sugar as a fuel source. And so you have energy spikes and you also have energy crashes. And for most people, energy crashes come, mid-morning, sometime before lunch, and then also usually in the afternoon between 2 and 3 p.m., where you have all this energy and then it's just like, boom, you hit a brick wall. And then, you eat again at dinner and energy spikes back up. Whereas with ketosis, which is what the whole ketogenic diet is, you're getting your body to burn fat. And when you burn fat, you produce a molecule called ketones. And your body can use the ketones as energy. And the big benefit to burning fat is that you have sustained energy release typically throughout the day, if you can get your body into ketosis. And that's kind of the hard part with this diet. It's just getting yourself into ketosis. And this is different than ketoacidosis, which can kill a person, especially type 1 diabetics. Ketoacidosis is the #1 cause of death amongst type 1 diabetics. But ketosis, it's very, very different. You're burning fat, you're producing ketones. But to get yourself into that fat burning mode, you have to pretty much eliminate all your carbohydrate intake. So here's kind of the ratio of what you do. 70% of the time, you're going to be eating nothing but fat. And you want to focus on the good fats, things like real butter, not the, country crapper that you buy at the grocery store. Do things like Kerrygold butter that's grass-fed, no additives in there, no injections or steroids in the cattle. Avocados, nuts, seeds, oils, extra virgin olive oil, coconut oil, just nothing but good fats. So about 70% of the time. The other 20% of the time is your protein. And this is another downer about the keto diet. If you're trying to build muscle, it's really hard to do. Keto diet is not good to do if you're trying to pack on muscle. You have to have a higher protein consumption. However, if you do higher protein with the keto diet, a lot of that converts over to blood glucose as well and causes you to fall out of ketosis. So 70% fat, 20% protein, and then about 5% carbohydrates. And that means 20 grams or less of carbohydrates per day, which is really, really difficult for most people. And if you do this perfectly, you may get yourself into ketosis within a few days, but typically it takes 1 to 2 weeks. And then there's something else that happens called the keto flu, where you basically just feel miserable for several days. But once you get into ketosis, a lot of people do feel really, really well. Sustained energy throughout the day, no afternoon fatigue, mental clarity, because your brain is using the ketones for energy. It is more efficient for brain function, but it's hard to stay in ketosis. If you have a vegetable that's not, that's maybe a little higher in starches, or fruit that has excess natural sugar, you will throw yourself out of ketosis, and all that hard work that you did to get into ketosis is kind of out the window, and you got to work at getting yourself back into ketosis. So it's a very strict, hard to follow diet. Now, for some, it may be pretty easy, not a big deal. For others, it's pretty difficult. And once you're into ketosis, yes, there's people who feel really, really well. That's about 50% of the people. And then the other 50% of people tend to feel pretty terrible. And I, about 2 years ago, just to try this out, because I like to, practice what I talk about. So I have some, background on it. I did keto to kind of see how I would feel. And I wasn't really trying to lose any weight, but did it about 2 years ago, got myself into ketosis. It took me about a week or so. And I was one of those people who felt pretty miserable. I mean, I was not happy, super cranky. My coworkers were probably not very pleased with me, but I just did not feel good doing it. But I will say, energy-wise, I had more energy. I didn't have the energy spikes, energy crashes. I lost about 5 pounds, which was pretty cool, but I can see where it's really, really hard to stay in it. Now, the other big issue with keto diet is just the amount of fat that you're consuming. And most people, they're going to see their total cholesterol elevate, and most people are going to see their bad cholesterol elevate as well. Not everybody, but a lot of people according to research. And so if you have a family history of heart disease or strokes, definitely probably not the best thing for you to take part in. So that's kind of my 2 cents on the keto diet. Like most fad diets, they come and they go. Some come really, really quickly and then they leave fast. HCG is a perfect example. It was a huge fad diet roughly 5 to 6, 7 years ago. I actually made a video talking about it here on the YouTube channel. You can check that out. I'll put it down in the description down below. And the keto diet, it's going to be the same. And I guess another kind of quick background on the keto diet, it's technically been around for a really, really long time. It was kind of developed back in the 1920s. There was a doctor, I'm probably going to butcher this, Dr. Gianfranco Cappello. He was the associate professor of surgery at the Sapienza University in Rome. And they developed this more for treating epilepsy in kids in pediatrics and had great success with it. But as anti-seizure medications were developed, ketogenic diet disappeared for a long period of time and then kind of popped its head back up here a good 2 or 3 years ago. So my advice to you when it comes to weight loss, follow the Mediterranean diet. And that's basically what we do in our practice. And what you're doing with the Mediterranean diet, you're eating lots of lean protein, things like chicken, different types of fish. You're going to do some good carbohydrates, things like brown rice, whole wheat pasta, quinoa, whole wheat bread, sweet potatoes. You're focusing more on foods that are eaten along the Mediterranean coast, and thus why they have some of the best health in the world. You can have things like a little bit of red wine, 5 ounces a day for women, 10 ounces a day for men. With that said, if you have a really hard time controlling your alcohol intake to 5 ounces and you have to do a lot more than that, don't do the whole wine thing with the Mediterranean diets. And then things like good fats, good unsaturated fats, extra virgin olive oil, avocados, nuts, seeds, different fats like that. It's just a much healthier way to live. And actually the Mediterranean diet still ranked the #1 diet in the world for the past several years in a row. I say diet like this. I hate using the word diet in our practice. We don't do diets. But when it comes to our food recommendations, we're basically recommending the Mediterranean diet. And to kind of give you an example of how quickly our patients lose weight, you've maybe heard me talk about this in other videos. Our average female patient loses 15 to 25 pounds in 4 to 6 weeks. Our male patient loses a good 25, 30, 35 to 40 pounds in 6 weeks. And then 12 weeks, women lose a good 30 to 50 pounds, men typically 40 to 60 pounds. And that's eating real food. That's not dieting, that's just eating the food that God created for us to eat, what your body absolutely needs for the best nutrition. Stay away from the fad diets. If you guys have any questions, call the number on the screen. Feel free to leave a comment down below. I know this is kind of a controversial subject for a lot of people because there's those who are just obsessed about keto. It's their whole lifestyle. They've lost a lot of weight. They're doing well with it. And I don't want to bash it for you guys. I'm just saying in the long run, it's very hard to maintain. And according to research right now, it's not the best thing for your overall health and wellness. And the other big downside to keto is that you're going to lose some muscle as well. Now, I said it's hard to build muscle on the keto program, but you're most likely going to lose a lot of muscle as well. So if you ever stop the keto diet, you're going to see that weight come back on fairly quickly. And according to research right now, most people put their weight back on within a year at the most. Most people a lot faster than that. Very similar to HCG diet. But again, call the number on the screen. If you have any questions, shoot us an email. And be sure to check out all the other videos on our YouTube channel. We work really hard at coming up with great content and answering some FAQs that we see in the office on a daily basis. So until next time, enjoy the videos. Hopefully this helped out a little bit on keto. Do your own research, but I would recommend just stay away from it. We'll talk to you next time.